This is Coach PDHPE with another Core 1 video. You can find other Year 12 PDHPE information at the website www.coachpdhpe.com. So Core 1, health priorities in Australia. We're having a look at the key idea: what role do healthcare facilities and services play in achieving better health for all Australians? Now this is the dot point: complementary and alternative healthcare approaches, and the 3 dash points there. I'll come to those in a minute. Once you've listened to those 3 dash points, you should be in a better place to be able to understand the right hand side syllabus questions. But first, to an overview of the actual dot point itself: complementary and alternative healthcare approaches. If you just give me a moment here, I'll crank up the nature music. We've got to get in the mood for this video. Complementary and alternative medicine gets sometimes referred to as CAM. Now, CAM can be anything from, getting off the yoga mat, getting the chiropractor to snap your back in half, getting some weirdo to, insert a couple of thousand needles into your body and claim that it's going to relieve you of pain. You might be able to understand from that brief little introduction, I'm a little bit of a cynic of CAM, but maybe you're a full believer in it, and that's great. But I'll just give you a bit of from now on, a bit of an unbiased view of complementary and alternative medicine. So let's go. First of all, one of the big debates is traditional medicine versus complementary and alternative medicine. Now, I would say pretty much that doctors and specialists versus the acupuncture, chiropractor and herbal medicine field. Many traditional doctors just don't simply trust CAM, or they think it's second rate, and even worse still, some would call them quacks. They think they're a waste of money for people and that it's unscientific and they provide no health benefits whatsoever. But the reality is probably something different. I think there's a balance there. I think there is probably some scientific evidence out there that some CAM services do in fact provide some good some healing in instances, and they do provide benefits to health consumers. So let's have a little bit of a closer look. The CAM industry is becoming increasingly popular in this country, and a term that you should be looking to use in any sort of question on this dot point is the holistic approach to improving your health. And what that means is traditional medicine plus CAM services equals holistic health. So yeah, look for any opportunity where you can insert that key term, holistic approach. So the first dash point: reasons for growth of complementary and alternative healthcare products and services. Some of the more popular CAM services in this country called homeopath, Chinese medicine, reflexology and Reiki. But the top 4 in this country include chiropractor. What else we got here? We've got naturopath, which is all about using herbal medicine, organic foods, acupuncture, and finally remedial massage. So they're the top 4 used, and I'll go into a little bit more in depth to that in the next dash point. But first, what is the reasons for the actual growth? But before we give some specific reasons, let's just have a look at the industry itself. It's a $4 billion industry in this country, so that alone tells you that it's a big industry. They're not minor players whatsoever. 1 in 2 Australians use some form of complementary medicine each year, so that includes something like vitamins and herbal medicines. But probably more a telling statistic is that 1 in 4 Australians actually use some sort of CAM service, such as acupuncture or one of the others that I listed previously. Now, since the early 1990s, there's been a 60% increase of the number of people who are using CAM services in this country. And that's got a lot to do with old people such as myself are moving on and replaced by a younger generation who believe in the usefulness of CAM services, and cynics such as myself are becoming maybe won over a little bit and even prepared to try some of the products themselves, such as I did earlier in the year with acupuncture. So let's get to some specific reasons for their growth. So Australia's ageing population is living with chronic pain, for example, a bad back. And people believe that complementary and alternative medicine products may appear to have much more to offer than traditional medicine, which has failed to to come to grips with sorting something out, like back pain, for example. So people are turning to the use of acupuncture and having success with it. Another reason is that Medicare is funding up to 5 services per year is now covered under Medicare. There's probably going to be a slight gap payment required to be paid by the consumer, but a large part of the fee is now covered by Medicare. And many private health insurance companies, such as NIB listed there, I know they're my provider, they cover some of the CAM products. Also, it's increasingly being offered as a tertiary education. So Bachelor of Chiropractic Science at Macquarie University, it requires an ATAR there, you can see, of 81. That's going to rule out most of the boys in my class. That's a little bit of a joke there to see whether they actually listen to this. So by universities increasingly offering more places, therefore it gains some more credibility amongst consumers. Probably the main reason is that people are wanting a more holistic health approach. So they're wanting to combine both traditional and CAM services. So what are the range of products and services available? I'm going to give you 3 examples here. I'm not going to read out all the information. I think you need to go off and do that yourself. But I'll give a quick sort of 20-second overview of each one. Acupuncture. Now, it's originated from a Chinese sort of ancient type of medicine. It's all about inserting needles into specific points in the body. What it's said to do is stimulate the release of pain-relieving endorphins, and therefore relieves many of acute pain problems in the body. It especially promotes targeting the healing of migraines, as well as helping to quit smoking, would you believe it? The next one, chiropractic, focuses, they're sort of the physio's number one enemy. They also, like physios, focus on the musculoskeletal systems and often treating back pain and neck pain. They're all about a drug-free approach, all about the hands, and their most common method is manipulating the spine. Finally, we'll go to naturopath. This is all about going back to good old-fashioned natural remedies, so going back to sort of herbal medicine, getting an organic diet. They're about treating the whole person, body, mind and spirit, and naturopaths claim they can pretty much heal just about anything. But some of the more common conditions is all about relieving stress, fixing up any digestive problems, and again, for the boys in my class, alleviating PMT. So, how to make informed consumer choices. As a health consumer, you can often get desperate when a family member is struggling with a particular health issue and traditional medicine has not been able to solve the issue, which our families experienced before. So you can get a little bit desperate and go to some alternatives such as CAM products. And so families living with cancer are probably one group who understandably often get desperate in an attempt to try and get a cure. And many people often revert to using or trying CAM products and services. Now, the Cancer Council of Australia has listed some suggestions on how people can make informed consumer choices when it comes to finding some pain relief or even healing for cancer. Now, some of these include contacting the actual CAM professional organisations, so that could be the Acupuncture Organisation of Australia, to get names of practitioners who are actually certified, so they've had some official training. Now, the problem with many CAM industries is that it's not very well regulated. It's a pretty old and saying that in terms of a lot of people get their qualifications out of a cornflakes box. That's probably gone by the wayside, but it's still wise to check with the actual professional organisations to see who has actually had the official training. Some questions you should actually ask the practitioner is what sort of training and qualifications they've actually had. Do you see other patients with that type of cancer or even illness that you're going to get trying to get healed? And will you actually work side by side with my GP? It's probably a bit of alarm bells should be ringing if they say that they don't actually work alongside traditional medicine. Some other questions, ask about the practitioner's training and experience, and also call your health insurance company to see if it covers any of the cost of the therapy. And questions about the actual therapy itself. Ask some questions about, are there any scientific studies that have been released to to prove that this CAM service will actually help. Will it actually interfere with the traditional medical treatment that the patient is using? And one of the things that, believe it or not, people don't actually end up asking is what is going to be the cost of the treatment. Now, they might bury that away in some of the fine print, and what you'll find with many CAM services is that you just don't go there for one appointment. They actually end up going back, requiring you to attend multiple appointments. And ask them, do they have any information or pamphlets that you can read to get some more information? So that will do it for this particular topic, complementary and alternative healthcare. I hope you found it reasonably informative. It's probably only going to give you a bit of an overview of the topic. You probably need to hit the textbooks to get some more information. Thank you for listening.